Assalamualaikum. Dr. Hussain Bashkolaji YouTube channel is with you, and we are just discussing a lecture video on measles. Measles is a very highly infectious disease in Pakistan as well as in the world, and this is also one of the re-emerging infectious disease problem globally, and a lot of concern is there, and there are certain outbreaks in the countries where it was completely controlled. So let us start with the video presentation so that we can complete in time without wasting the time. You can see that the measles disease prevention, and we will also look into the research and AI role, what future can be in that area. So let us discuss this, that this lecture overview covers the key aspects of measles, an acute, highly contagious viral disease that remains a major public health challenge. And this is the map which shows that the measles is, if you see the gray areas and as well as the areas where it has been controlled even, but you can see that the south, north, west, you will find the measles too. This is one of the patient of the measles. You can see that how the rashes are so spread on the body, and even the entire body is just like full with rashes. So these are few learning objectives: etiology, transmission, pathogenesis of measles virus, clinical presentation, epidemiology of measles with focus on global burden and specific challenges in Pakistan, the role of live attenuated vaccine and its effectiveness will also be covered along with AI. You can see that the epidemiological data shows that in 2024 there were estimated 95,000 global deaths, not cases, and you can imagine the problem, mostly in unvaccinated children under 5. As of February 26, outbreak continued despite a 75% reduction in cases in some regions, as I have already told in my introduction. But in Pakistan, 16,000 cases were reported, with less than 50% occurring in unvaccinated children. So, unvaccinated children have a complication, as well as you can see that 95,000 global deaths, mostly in unvaccinated children. So, measles in vaccinated children, if it occurs, it is light measles, but if you are unvaccinated, then the more complications are there. A national measles rubella campaign in November 2025 targeting 34 million children 6 months to 59 months, means almost 5 years, were vaccinated in Pakistan. That is a good news and very good understanding that measles will come down in Pakistan as a result of these campaigns. Then moving to the other side of the slide, let us look into that. What are the differences? I'm going to next slide. Here you can see that the differences between measles, chickenpox, smallpox. One of the measles rash appearance, maculopapular in measles, and dewdrops in in the chickenpox, and dome-shaped pustules in the smallpox. So let us see that difference, you can see that the dense rashes, red and on the chicken pox, these are scattered and not dense rashes. And this picture will show you the various symptoms as well as the importance of the measles. And you can see that the coptic spot are mouth, whitish spot on the mouth, and the rashes they start from the head and come down, and the central portion is more affected, while the arms and legs are less affected, but they are affected. Uh, while in chickenpox, the they start from the belly and go upward, and they are more dense. Scars or rashes are there. So both are droplet infection and both affect the children. Let us see the whitish spot inside mouth. In chickenpox, there is no whitish spot. These are the prognostic or the earlier symptoms. And at the top, you can see the picture of monkeypox, smallpox, measles, and chickenpox. And you can see that these are the dome-shaped and scabbing means permanent scar. Here you will find the just as a rashes, and here you will find the rashes, but they are just like a dewdrops rashes. And here you will find different pattern of the rashes or pleomorphism. Uh, Coming to the next point, the role of new research, AI for surveillance and prediction, machine learning models as well as KNN random forest predict outbreaks with 87% accuracy by analyzing vaccination coverage, demographic data, and location. Another AI tool is zero dose identification. AI analyzes fragmented data to locate children who have received no vaccine. And Vax Esteem AI tool now quickly identifies low vaccination rates in real time, allowing proactive intervention. Chatbot, AI driven chatbot, as example, baby bot in Pakistan, that is, I think, very important, provides 24 hours to 7, 24 to 7 information to caregivers to combat the misinformation about the vaccine and measles, and microarray patches, MAPs, and new needle-free heat-stable patch technology allows community workers, not just to nurses, to administer the measles vaccine in remote area. So this is a patch, not the injection, that will reduce the fear, and 5 dose while transition from 10 dose to 5 dose while reduces vaccine wastages, especially in small and low coverage area or in clinics where few patients are coming. After this, we will touch some of the aspects of the clinical symptoms, fever and cough, runny nose, red eye is more in measles, while red eye is less in chickenpox, and duration is 12 to 10 to 12 years means longer duration, and chickenpox has less duration. Then coming to the more clear picture here from, you can see that the pink eye is in the measles, while fever, headache, and no pink eye. But then symptom progress, red, blotchy rash along the hairline of the forehead means from the upper side, and raised spot typically on the chest, face, and back, not on the hairline or the front. of the head. Coptic spot, tiny whitish spot from inside the mouth. Red spot turn into blisters and spread all over the body. These are the chicken pox. The duration I have already mentioned. So for the general practitioner, I think this chart is important and they can see where from the rashes have started from the hairline or non-hairline and duration as well as the coptic spots. Then coming to the measles eradication integrated campaigns combining measles rubella campaign with polio campaigns to boost coverage, digital health record using platforms like DHIS2 to track in real time children